Okay, Barry, a man in Ireland, asked me a question about my insurance. He wrote me an email and he said, Andy, I know you're paying, or he said something to the extent that you're paying $100 a month for health insurance. And I think he misunderstood my insurance, but I'm going to try to explain my insurance. And this is kind of Charlie Foxtrot. It's like pulling a thread on your clothing and trying not to have it unravel your whole shirt. Okay. Uh, Anytime you start talking about insurance, it by design, in my opinion, is meant to be not understood and it's meant to make you afraid. When you buy insurance, there's nothing about it that makes me feel insured. What I tried to buy insurance when I was, I don't know, 27 years old or something like that. And they wanted so much money that I sit there and I go, I would be only working for my insurance. Okay. And I have not had insurance ever, except, well, I guess I had insurance up till age 23 because my mother and father had insurance on me. And when I first got in a motorcycle accident and broke my femur when I was about 23, I was covered by insurance, my mother and father's insurance. But the family insurance, and one of the reasons to work at a job is, and one of the things I've always had trouble competing with, is that even McDonald's will give you insurance, okay? And this is part of being an employer, is that you get these group rates and you have insurance. But insurance is the same for me as it is for a person that is living inside England, Europe, United States, Germany. It doesn't matter where you live. Okay, what always the dream is that we have this universal health care that means that we don't have to worry about getting sick. And I have yet to hear anybody on the planet ever describe that kind of insurance. There are people that will not leave their insurance because they don't. My mother was a great example of this. She was constantly afraid that she wasn't going to have enough money. And it's really unnerving to think that you can be 75, 80 years old and don't know if you have enough money to live. And I asked her one time how Danny Sutton, which is now dead, he had colon cancer or something. He was our neighbor. And I said, how does he have insurance? He doesn't work, blah, 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 right? And she goes, he's on Medicaid. And contrary to what you think, inside the United States, if you have no money, okay, you can get taken care of, especially I think when you're over 65. I don't know exactly the thing, but if you're absolutely broke, you become kind of a ward of the state. So probably the only safe way to be in any country is to be a ward of the state where they take care of everything. But you have to prove that you have no money at all. And that's not the goal in the United States, right? But traveling, if you're going to travel the world and you want to worry about health insurance, my advice is to stay home. There is no way to feel safe. There is some countries where, like when I got in a car accident, well, I got hit by a golf cart in the Dominican Republic, and they would not put me in the hospital until I gave them $800 thing. So I literally was in the I was in the thing because what is the biggest worry when you're traveling? It's worried that you're going to get in a car accident or some kind of accident, and you need to be covered. So they have these fly you out of the country insurances, which is not going to work, right? Because they have to save your life for the next three days. Now I was not dying, but I had a broken tibia, and I was literally in the hospital. And my one friend of mine Johnny went into my room, got my ATM card or whatever, and they took $800. Then Then the what do you call it? The ambulance left for the hospital, but they didn't go to the economical hospital. They went to the private hospital because everything about the medical industry is a business. I could have went to a much cheaper hospital, but I really didn't have any choice because the ambulance made the decision for me. And this is the problem here. Everybody wants to act like they're going to control what happens, and life is uncontrollable. And if you want control, you want the fantasy of control, stay in the same insurance you're in. Because the best way to look at it is when you travel, what you have is this window of problems. The biggest one is I could get in a car accident, I could have a heart attack, or maybe a stroke. There's probably other types of situations, but with a stroke, my brain could be, it wouldn't be able to think, right? I wouldn't be able to deal with any kind of the issues. A heart attack. So these three things are instant problems. And when I was in Nicaragua, somebody was asking me about insurance, and I did some research. And as I understood it, in Nicaragua, if you get in an accident, the state of the country of Nicaragua will manage the expenses up to the point that you're okay, and then they'll basically cut you loose. And a lot of countries will do this, and even in the United States, if you go into an emergency room, they're going to basically solve all your problems and then bill you, okay? And this is the insurance of everywhere on the planet. They don't really know what to do with you if you get in a car accident. And I do know that in most places, they're trying to figure out how to make you pay. But if not, they're going to take you someplace. So my belief is that anywhere on the planet, if you have a heart attack, you have a stroke, or you have an accident, a car accident, what they're going to do is they're going to take care of the problem. In the United States, for sure, you can just show up, and as my understanding, and they're going to all deny this, okay? They're going to all act like you can't do it, but you can show up in a emergency room, and they're going to take care of you. You're not going to be able to come in there for a cold, but if you have a life-threatening problem, they're going to do it. So this is the only thing I worry about when I'm abroad. Life-threatening. Now, I do have insurance now, which is part of, I don't know, Medicare or something like that. And Molly, my insurance agent, is 10 times smarter than me, and I do not try to debate with her. I allow her to be an expert. So Molly's got it so that I only have, I guess, as I understand it, a $219 a year deductible, but I get about $550 plus Medicare, whatever that means. I don't really care. Why don't I care? Because what I care about is prevention of going to the doctor, not wanting to go to the doctor, okay? So I get about $550. After all my insurance, I pay about $200 a month in insurance, and then it's coupled up with my, I don't know, whatever, Medicare, whatever, and as I understand it, I only have a $200 deductible. Now, what does that mean? That don't mean crap. Anybody that knows insurance knows there's things that are not covered, and there's this fine print, and insurance is meant to be like a way to tax you almost. It's a way to get you addicted to the doctor, and it makes you afraid that if you don't have insurance, you're going to die. You're not going to die. You're just not going to have the money. So the reason to have insurance is if you're worth $10 million, that they can't bill you for $10 million. It's just a buffer between you and all your expenses. So the best way to have insurance is to have no money. Okay, contrary to what you think. If you really want to be protected, have zero money, then the government's going to take care of you. Then it comes down to, you want better service than the public, the masses, the proletariat, the normal working person. So you want special insurance. Then they sit there and they say they want to go to a private hospital. Okay, but inside the United States, you can do all these games, and inside Europe, you can play all these games, and you're already playing the game. If you have insurance, you're in this game. I never got in the game because I always was self employed, and I could never justify paying for insurance because to me, it just was one of those things that if I have insurance, they're going to bill me more. Okay. I don't see that I save much money with insurance. I just believe I was one of the lucky ones on the insurance. I didn't have any insurance from age 23 to age 65. And I never had any kind of medical issue that was big enough that I couldn't just go to one of these 24-hour places where you just pay. I had one time where I paid twice $125 to one of these ready-med places because I had an infection. But I got rid of all the infections after I gave up sugar. I haven't had any kind of, I used to always carry, one of the benefits I thought of living abroad is that I could go to the pharmacy and get amoxicillium. Little did I know that all I had to do to get rid of the amoxicillium and stop carrying all the antibiotics was to give up 90% of the sugar, and just because sugar is what causes, in my opinion, infections. So I haven't carried any amoxicillium, I don't know, probably for about 8 years. But I used to always have it, buy it in bulk, and because it's an antibiotic. And one of the benefits of living abroad is that you can just go buy most general things. And 90% of the people don't go to the doctor. They go to the pharmacist, and the pharmacist gives them the ready available solution to their problems. Then you have this like 5% of problems that they're undefined. I tried to go to the United States. I went to a doctor, a female doctor in Fort Wayne, Indiana, and they delayed me for another 30 days. I go, hey, wait a minute. This isn't anything slightly convenient. I could be dying in the next 30 days. People that, you have a choice. You can go to the emergency care or you can go to the ready med. And it's a way to charge you money to go outside the insurance and pay because you need immediate attention. People talk about having universal insurance in England, or they do it in maybe Canada, and they always say it's delayed 6 months. Doesn't really work. Okay, I could actually be self-insured outside the United States. So in my opinion, to be self-insured, how much money do you need abroad? You need to right around $5,000. My car accident cost $7,000. But if you had $10,000, so the $10,000, if you travel in the 200 normal countries, that's going to be an exorbitant amount of money. If you want to travel in Germany, France, England, all these places, you're screwed, okay? Because the cost is about the same in the United States. So my advice is to always stay out of the overdeveloped countries, okay? Because all they do is they're very good at collecting taxes, they're very good at collecting money, and they're not very good at letting you live. Okay, so I live in the 200 normal countries and stay away from the overpriced 25 countries. And when I go in there, I go into the United States for 1 month, 2 months. I go to Germany for 1 month. I don't stay there because to live there would be it'd be the same problem as the United States. I have to get insurance. I have to get a residency. I have to be owned by the country. And then I spend all my time worried about going to the doctor. But the truth is, I have insurance. I have full coverage insurance. And so I'm recommending that you do exactly the same thing you do in Ireland. Have your coverage insurance, do everything if you think you need it. And what do? If you have your normal problems like cancer and emphysema and all these chronic ailments, COPD, and all these there's like 10 chronic things, type 2 diabetes, a self-inflicted medical problem, overweight, obese, all these things are things of being captured by you're on that treadmill and you can't get off of it. You're enslaved by all the things that you think you need instead of the things there are things you think you need and things you want but don't actually need. Okay, one of the great benefits of travel is you only need about 1/40 40-liter. I have 2 backpacks, and that's all I really need to be happy, to be free. Anything more than that, and I have no freedom. But you do collect things when you live in a place. I'm ready to declare my freedom from Lake Athlon. I've stayed here way too long, and comfort is a trap. Okay, but what do I have? I have the same insurance. So what I'm saying is get the same insurance as you got in the United States, or same insurance as you got in Europe, same insurance you have anywhere, and use it, and then go travel and realize you need about $5,000 or $10,000 as a buffer. And then if you get in a car accident, you have a heart attack, you have a thing that $10,000 pays, and always keep your money away from people, because what hospitals and the medical industry is great at is taking all your money. That's what they do, and that's what a country does. A country wants you to sign up to be a resident so they can take all your money. Okay, United States, I only want to owe one country for my residency. United States, to have a residency in 10 countries is to sign up to be on kind of their tax rolls and be part of their database to collect money from you, because that's what the job of a country is to do. They give you some benefits in exchange for money. They don't just give you all the benefits of a country because you're there. Only countries like Norway that has like $1 trillion in oil, or Dubai, can give you just everybody just free whatever, because there's an overabundance of oil. So I guess if I wanted to live someplace and I wanted to be completely free, I'd go live in Norway, because they can give all their citizens freedom. But universal health care, Obamacare is not universal health care, okay? It's just a game of words, okay? Universal health care means I would get a card. I would walk in. Anytime I need medical help, I would just walk in, give the card, and I wouldn't have to worry again. That's not the way it works. They spend all their time talking about things that are covered and not covered. That is not universal. That is, maybe it's covered. Maybe. This is the game that everybody in insurance wants to play. They want you to accept that you're not insured, but you're pretending to be assured. You say, I got it, full coverage insurance. I do not have full coverage insurance. It doesn't cover anything and everything of what I could get sick. So the only way to have full coverage insurance is to never go to the doctor. But right now I'm in I'm in Charlie Foxtrotville, because I don't even have a regular doctor. So if I go to the United States, I can't even get, the only place I can go is to the emergency room, which is not going to be covered, right? So I'm trying to find a regular doctor that will treat me remotely. This one lady, the minute I said that I wanted to, she had no desire to have me as a patient, because she knew that she couldn't put me on the regime, the monthly thing, because that's what they do with people over 65. They put you on a monthly appointment where every month you have an appointment. Boom, boom, boom. You're actually taught that if you don't go to the doctor, you're going to die. My mom used to say, Andy, you need to go to the doctor. I said, no, they'll tell me something's wrong. You ever go to a doctor and not have them give you some pills or whatever? That's not how they work. They know that the only way to keep you as a patient is to tell you are sick and give you something. It's like an attorney. An attorney's always going to find a problem. Always. Just part of what they do. That's how they make the money, finding problems. They cannot just say that a contract's good. They are trying, because if you went to an attorney and he or she said that you was okay, everything was great with this contract, what would they do? You wouldn't feel like they owed you money. It's like this ding-a-ling over in, I solved the ding-a-ling's problem over in San Pedro. I called up on Talk Spanish and got his computer person, and it only took me 5 minutes to do, and he considered it worthless. And I said, you haven't been able to use your computer for 2 weeks because you couldn't solve the problem, and because I solved it in 5 minutes, it has no value. This is how stupid people are. What you want is a doctor that says, Andy, you're in perfect health, keep on doing what you're doing. You want an attorney that says, hey, this is what, but you will not, because humans are biased. They don't want to pay for nothing. People don't want to be, don't want my advice, they consider it worthless because I give it away. Stupid. You just spent, 25 minutes, 20 minutes listening to this advice, and that had value for you. And if it had zero value, you would have stopped watching the video. But again, what is the secret? The secret is that the only way I can truly think about it is if you had 10,000, maybe 15,000 US dollars, you only travel to the 200 poor countries. If you're in one of the overly rich countries, you're in danger. The only time I feel in danger or really scared is when I'm inside the United States because I cannot afford the United States cost of living. I cannot afford the medical system. I can't afford anything. I can't even get into a doctor. I can't have a doctor unless I sign up for this monthly thing, right? They don't even want to deal with me because they make all their money. Doctors are about money, okay, as are attorneys. Very few doctors are, they want to be rich, okay? That's why they became doctors. And the only way they can get rich is to cause a problem, to say there's a problem. So I can't even get a doctor. But again, it's just have full coverage, deal exactly with the way you're dealing with your medical system already. And are you going to quit your job and have insurance? 90% of you will not have any insurance if you quit your job. Therefore, you have to work to your age 65 to get on Medicare inside the United States. It's all a treadmill. It's a never-ending vicious circle, and you're never going to be happy. So, but the easy way to do it is to do it like me. Have about $5,000, $10,000, or have family that will insure you. If you don't have anybody that will help you, you need to stay home. If nobody is going to, you can't call up anybody in the United States and get them to run an errand. You need to stay home, okay? You can't call up somebody. You don't have any friends. You ought to figure out how to have friendships. Can't barely see the screen. I can't tell if it's actually recording. Okay, so you have $10,000 to $15,000. Then you use your normal insurance, and then anything that is a problem, you fly back to the United States or Europe or wherever you got to fly and have your work done. And then you're going to be back into the treadmill where you can't afford it, right? So first things first is I try to do everything self-insured. I do all my medical work outside the United States. I have no faith whatsoever in the United States medical system that they are going to take care of me or that they even care. They are going to block me from getting an appointment. They're going to block me from getting an appointment. They do it. There is no way for me to just become a patient of a person unless I can prove that I can pay. And that's all they care about. So inside the United States, for any kind of small problem, I get to go to the ready-made place and pay through the nose $200 to just get somebody to prescribe what? Antibiotics. So why do I carry antibiotics? When I go back to the United States, I carry antibiotics. I carry malaria medicine because inside the United States, it's not reasonable. It's not legitimate. It's not universal health care. There is no health care. They're trying to give you an illusion. But the illusion that you have insurance is what they want to sell you. Okay, I hope that helps, but simple as you can get about $10,000, have medical insurance. If you really believe that you have to work until you're age 65 or somehow you get put on the dole or something like that, you're trapped. You're never going to be free. I left 26 years ago, just 1st of March of 2024. I've been living abroad for 24 years. But what do I spend my whole time doing? I spend my whole time trying to understand how to be healthy and not be addicted to my fears or problems or temptations. 90% of people just go from temptation to temptation. But fear, anger is fear. Fear, anger, all this confusion and this addiction to problems is the problem with the United States. If you never heard of medical insurance, if you lived out in the jungle, you'd be a lot happier, because the goal of an insurance company, the medical industry, the attorneys, and all the government is to keep you confused so that you become their slave. Problems, this addiction to problems that don't exist, there's real problems, right? But just deal with the real things and separate the games. I have people continually ask me about insurance, and I go, you're not really brave enough to travel. Because if you're thinking about insurance, the insurance company owns you. And that's what they want. The government owns you. The insurance company owns you. Everybody owns you. Your fears own you. Everybody owns you except you. Make a decision to say, I'm free range and I can be anything I want to be. And guess what? Even if you have a problem, they're going to solve it. Nobody actually ever just dies laying in the street because of an accident. I never heard of it. They will pick you up, take care of you, and try to push you out the door as fast as they can, so they spend the least amount of money. But they're going to take care of you. The whole world has become incredibly good at medical treatment. What they haven't, but the really great countries, the ones where everybody feels safe, which are not safe, what are they really good at? They're very, very good at collecting taxes and forcing you to pay. And as always, you can just file bankruptcy and get rid of all of them, right? Not really what people want to think about, but that's the truth. Inside the United States, if you have zero money and you're on Medicaid, you're free. Everybody else is worried. Don't worry about life. Worry more about living. That's my advice. Worry about how to live your life, how to be mentally, emotionally, physically strong. I'm here and you're not. Why not? I hope that helps. Again, I tell you, it's quicksand. There is no way to talk about insurance without being confused. But it's like a stock. You should never buy something you can't understand. All I understand is I know Molly is taking care of me, and I believe in Molly. I don't believe in the insurance company. I believe in the expert that studies this all the time. And if you don't trust an expert, you don't trust anybody. I don't know. I don't know what to say. Most people won't trust anybody, and they always think they're an expert. There are experts in things. There are people that are trustworthy. If you can't trust anybody, you don't trust yourself. I'm Andy Lee Graham. Become a Patreon and make my life better. Keep me talking.